Hi everyone, Dr. Carrie here, and we're here to talk about the third trimester. If you have any questions or comments or things you want to know about, leave them in the chat and I will try to check them. So welcome. So third trimester, I'm really excited to talk about this because I feel like this is when I see a lot of clients. So my specialty is obviously pelvic floor therapy, but I see a lot of patients for pregnancy, for other things. And I want to say, like, you don't have to suffer through pain through pregnancy. So I see a lot of patients who come for tailbone pain, for back pain, for hip pain, pelvic pain during pregnancy. So it doesn't have to be just like, oh, like I can't have sex or I'm leaking urine, physical therapy can help with all the pregnancy related pains too. And I'm really honest with my patients, like, are you going to be 100% pain free? Probably not because you're pregnant, but we can get you much more comfortable in a few visits and giving you some exercises and stretches to do at home, and just some tips to help you. So there's a lot of things physical therapy can help with during your pregnancy. It's not just afterwards. But if you listen to my first two talks about the first two trimesters, I really encourage people to strength train the best they can, like even before getting pregnant or early in their pregnancy, because that will help support your body when during the time, like during pregnancy, the hormones are making everything relax and you have less stability. So our muscles can help create more stability. So that is one of my recommendations. So as much strength as you can build. Even in the third trimester, we can still build strength. If things are painful, we can stretch, we can strengthen still. So there are things you can do. Prenatal massage is also helpful. Our massage therapist is out for right now, but there are others. If you live in the area, I can give you recommendations. But one of the things I really want to talk about is birth prep. So preparing your pelvic floor for birth, for hopefully a vaginal birth. And so this is one of the things that I see a lot of patients for in the third trimester, is not, some people don't have any complaints, but they want to come in, they want to prepare for birth, they want to prepare for postpartum, they want to, help themselves have the best natural birth possible. And so I love doing this. I think it's like so informative and so fun. And so the things I teach people in the third trimester, so sort of like 35 weeks, 34, 35 weeks, we want to shift from strengthening stability to starting to stretch and open the hips and the pelvis and the pelvic floor and help them learn to relax. And again, if you listen to my other talks, I generally don't recommend kegels during pregnancy, but especially, so some of my patients need to do kegels because they have bladder leakage or they have like legitimate reasons to do them. And I tell them like around 34, 35 weeks, like stop doing kegels unless you really need to do them. But especially in the third trimester, we want to start shifting towards opening, relaxing. And so that's one thing I really go over with patients. So I will show you this. So this is called biofeedback. So this little machine, it's not going to do anything. I'm not going to turn it on, but it will, well, I'll show you. There's sensors that connect to our skin outside the pelvic floor, and this red light shows your muscle activity. So when it's down here, it's really low, and that means your muscles are relaxed. And so this is something we test in the third trimester. And so yes, we can see your kegels, how strong it is, but really we want to know, like, are your muscles able to relax? Are you able to push and keep your muscles relaxed? That's one of the things I really teach people in the third trimester if they're coming in for birth preparation. Also with this machine, there's sensors we can hook up to the pelvic floor, and we can test different birthing positions. So that I also really love. You don't have to give birth on your back. And even if you get an epidural, there are options on the bed. I test a bunch of different positions with people, and we find, like, the 2 or 3 that your body likes the most. And I tell people, like, whatever the position is, let's say it's squatting, like, oh, your pelvic floor is really relaxed, it's really open. For some people, squatting's amazing, because the pelvic floor muscles naturally are on stretch, and they're more open and relaxed here. But if squatting is hard for you, your pelvic floor is not going to be relaxed. But whatever, like, the best position on the biofeedback machine is it's not like you're going to labor and birth in just that position. So that's why we test different positions. And I tell people it's just to have an idea, to know, like, oh, I feel really good here. And honestly, I've had patients who don't want to get undressed, don't want to do anything directly on the pelvic floor. So we just test different positions. And they're like, oh, I feel relaxed here. So, like, whatever position they feel relaxed in, their pelvic floor will be relaxed. So it could be squatting, it could be kneeling, it could be standing, it could be sitting, it could be on your side, it could be on hands and knees. So there's a lot of different options. And yeah, like I said, we'll find a couple different positions that people feel good in. So to me, that's super fun to, like, figure that out, and for people to be like, oh yeah, this feels good, and they can compare that to laying on their back. So now they kind of have an idea of, like, oh, like, this is where it feels good, this is where I'm relaxed, and my pelvic floor will be relaxed here, and I can push better. So I love doing that. Another thing that we also do in the birth preparation sessions, I'm going to show you the pelvic floor model, is called perineum stretching. So this is the vaginal opening. And so with perineum stretching, so the perineum is technically this area between the vaginal opening and the rectal opening. And most commonly, this is where you'll tear. So you can stretch this in your third trimester. So again, around like 34, 35 weeks, you can start stretching this. And so what I tell people is, if you think about this as a circle, we want to stretch the bottom half of the circle, because if you can imagine being inside, at the top, you're going to hit this bone, right? And then this is why you tear the most, because this is where things can stretch. Like, there's nowhere to, you're going to hit an end here. And then the pelvis is going to open. And so you can stretch some this way, but there's a lot of room to stretch this way. So perineum stretching, I tell people it's about 1 knuckle. So my first knuckle here, deep, inside the vagina. And we're just trying to gently stretch this, and kind of warm up those tissues. So obviously when you're stretching it, you're not going to stretch it as much as, like, in labor, but you're sort of preparing these tissues to be able to stretch. And for some of my patients, they have tightness in these muscles, so we're trying to work that out before they go into labor, so that these muscles can relax and they can stretch and they can open. And so one of the tools that some of my patients use, pregnant and not pregnant, but this is sometimes helpful because so perineum stretching, often you need a partner because it's hard to reach over your belly into this, right? Some people can. You can do it standing and do it from behind. That's a little bit harder because you're also not relaxed if you're standing. But there's a tool. Let me see if I can show this to you. This is called a pelvic wand, and it's made out of silicone, but it's like pretty stiff. And so this becomes like an extension of your hand. And so I'm going to show you with a different view. This basically gets inserted, and you're just, if you look from the inside, just kind of like stretching these muscles a little bit. So that's one option that can kind of help you get past that belly. A lot of times, though, their partner is who's doing the perineum stretching for them. I hear mixed things, in labor. The nurses or the doctor or your partner can also do that in labor. Some people love it, some people hate it, some people find it helpful, some people feel like it made them more uncomfortable. So everyone's different. Yeah, so let me see what else is on my list. Yeah, so the other thing that we really do is then some just like general stretches is another thing I teach people, like stretching your hip flexors, stretching the back of your hips and your glutes, stretching your inner thighs. All those muscles surrounding the pelvis too are important that those are flexible. Yeah, and then I really tell people, like I said, like kegels not so important anymore, especially after like 34, 35 weeks. That's sort of the time period we're really starting to like shift into like delivery mode, opening mode, not strengthening. And so, yeah, so I also practice in the clinic the ability to push, the ability to stay relaxed through those contractions. So yes, let's just clarify on this. Your pelvic floor muscles are not what's pushing out the baby, but it's your uterine contractions, right? That's involuntary. That's just happening. But we want the pelvic floor muscles to not get in the way and to assist that process. So that's really what we're training for, is to find those positions where you're comfortable, your pelvic floor can be relaxed, and then train your body to know what to do, because naturally when things hurt, we tighten. That's a natural response. And so during childbirth, vaginal delivery, we want those muscles to stay relaxed and open and push out with the uterine contraction. So yeah, and so that's like the bulk of what I teach people in those prenatal appointments. And most people leave feeling like, oh, I learned so much. So it's not a childbirth education class. I recommend people do that too, like learn more about all of it. But this is specific to the pelvic floor, and it's very helpful. Yeah, and a lot of my patients are like, I didn't tear, but also birth is birth and we can't control everything. So I do like to, prepare for C-section too, and just know like how to recover from that. So we talk about that. And then next month when we talk about the 4th trimester, we'll talk about that more. So yeah, I'm not talking about all the other medical stuff. I'm just talking specifically about the pelvic floor when I do these 3rd trimester appointments. Yeah, and so the other thing is, if you're not local to me or you don't have access to a pelvic floor therapist, I do have an online course about preparing your pelvic floor for birth. And so we go over in more detail all these things I talked about. And then obviously we can't do the in-person testing, but you can sort of practice these things on your own through like the course, and learning, practicing, trying different positions, birthing positions, and seeing what your body likes. And then also like, practicing a little bit of kegels, but practicing a little bit of pushing. So sometimes it's a little tricky to figure out on your own, but the online course will like sort of talk you through that more. So if you signed up for our, or if you're here and you didn't pre-register, send me an email, because we'll send out a little bit of a discount for those people. But yeah, so basically my main message is go see a physical therapist during your third trimester. We can help with the aches and pains. And then, if you're planning to have a vaginal birth, we can help with all these preparations to help reduce your risk of tearing, help you have a better birth. I don't know if comfortable is the right word. I don't think labor is comfortable, but to help the process and help it go well, and then hopefully help you recover better. Um, so we want strengthening early on in pregnancy and through a little bit of the third trimester, but then really 34, 35 weeks, we're really shifting to like hip openers, stretching, relaxing, things like that, breathing. Yeah, so any questions? I don't see any questions. Okay, just checking. But yeah, thanks for joining me. And then next month we'll talk about the fourth trimester, which is probably the most people I see. The majority of my population in the clinic is postpartum. So I love talking about that too. But yeah, the third trimester, I see tons of people there. I love doing this. There is help. So yeah, use your resources. All right, thanks for joining me. See you next month.